The objective of this video series is to demonstrate physical exam techniques that will aid in the comprehensive evaluation of the musculoskeletal joints of the body. A consistent approach should be taken of evaluating any joint and should include inspection, palpation, range of motion, strength or neurological testing. Additionally, in some situations, special tests may provide helpful information and should be performed as indicated. Note, it is often helpful to ask a patient to point to the painful location, as it can be difficult sometimes to explain only in words.
Hi, Mr. Parks. My name is Dr. Kim. I hear you're having some neck pain, is that right?
Mm-hmm.
Is it okay if we do a physical exam and take a look at it?
Yes.
Great. I see you're wearing some shorts. Is it okay if we remove your robe so we can examine you from the waist up?
Sure.
Great.
This specific video segment will go over the components of the cervical spine physical examination. You will inspect for scars, masses, atrophy, and deformity while keeping symmetry in mind.
Okay. All right, let's start by having you stand right here facing me. Great, we're just taking a look at your head and neck area. Now go ahead and turn around and face the wall over there, and we'll do the same from this side.
You will palpate the spinous process, cervical paraspinals, and upper trapezius.
All right, next I'm going to be pushing some spots on your neck. Let me know if you feel any pain or discomfort, okay?
Mm-hmm.
All right, we're gonna start right in the midline of your neck, pushing on the bones there. Does that feel okay?
Yes.
Okay. Next, we're gonna move on over to the side and push on some of those muscles. And we'll do the other side as well too.
For a range of motion, you will test for flexion, extension, lateral rotation, and lateral bending.
All right, next we're gonna take a look at the range of motion of your neck. Okay, so go ahead and put your chin all the way down to your chest and look straight at me again. And now all the way back. Great. Next, I'd like you to turn your head all the way to the left and all the way to the right. And straight at me again. Great.
Neurological testing includes upper extremity strength, sharp and dull discrimination, and reflexes. Special tests, if indicated, include the Sperling maneuver.
Next, we're gonna go and do a strength exam, and we're gonna be looking for any weakness in your arms. So let's start out by having you hold your arms right over here, and then don't let me push, okay? Perfect. Now hold your arms in front of you like this, and don't let me pull your arms. Now try to push against my hand. Great. Next, I'd like you to hold your wrists in front of you like this, hold them strong, and don't let me bend your wrists. And now the other way, don't let me move them. Perfect. Next, stick your fingers out in front of you like that, and don't let me squeeze your fingers. Great. And can you cross your fingers for me like this? Great, thanks. All right, next we're gonna do some testing of the reflexes in your arms. So we'll start out by testing your elbow. Go ahead and relax as much as you can. All right. Next we'll hit at the front of the elbow and then at the forearm. All right. Next we're going to do testing of sensation. So we're going to break this Q-tip in half. And you're going to tell me if the sensation that you feel is sharp or dull. Okay? So let's have you close your eyes. And whenever you feel something, tell me if it's sharp or dull.
Sharp. Sharp. Dull. Sharp. Dull. Sharp. Dull.
Great. You can open your eyes now.
The Sperling maneuver is indicated if you suspect cervical radiculopathy. To perform, gently apply downward pressure on the patient's head while in an extended and laterally rotated position. It is positive if there is pain, numbness, or tingling.
There's one more test I'd like to do testing your neck. So can I have you look up and to your left behind you? Hold that position there, and I'm going to push down on your head. Great. Did you feel any pain?
No.
Okay, we're going to do the same thing on the opposite direction. Look up and to your right, and I'm going to push down on your head. Did that feel okay?
Mm-hmm.
Great.
That concludes the cervical spine physical examination video.